Hi, my name is Connie Koklanis and you're watching the video on anti-suppression exercises. Anti-suppression exercises are prescribed to patients who clearly have suppression and you want to eliminate the suppression in order for you then to proceed to utilising convergence or divergence exercises. So anti-suppression is the first stage or the first step in managing a patient who you want to assist in taking control of the deviation or even improving in terms of their convergence near point. So as an example, if you have a patient who has a poor convergence near point and on break they suppress, you can't manage that patient unless you anti-suppress them so that they can appreciate diplopia at the break point. The same goes for a patient who has an intermittent deviation. If you want to assist that patient to control that deviation, then they need to appreciate diplopia when they break down into being manifest or having a manifest deviation. If they are suppressing during the manifest phase of their deviation, then they cannot proceed, or you cannot proceed to prescribing exercises that will improve control, such as fusion exercises or relative fusion convergence exercises. So essentially we want patients to appreciate diplopia because diplopia, remember, is the stimulus for fusion. We need to see two images in order to put them together. The other is that we want the patient to be able to appreciate physiological diplopia because many of the exercises we prescribe are based on the principle of physiological diplopia. Remember also that physiological diplopia is an indicator of the eyes being aligned. So it also assists your patient to determine if they are seeing a single image due to suppression or a single image due to having BSV. Now, because we have a suppression scotoma in two places, at the fovea and at the CIP or in the periphery, we have exercises that are tailored to eliminating the suppression scotoma at either of those locations. Okay, here are a list of exercises that are tailored to eliminating the suppression scotoma at the fovea. I'm not going to go through these in detail. They are available, or details are available on these exercises on LMS. But what you'll see here is essentially you're attempting to have the patient use their fovea in order for them to anti-suppress. So as an example, if you choose to occlude your patient, so you occlude the dominant eye, what you're asking the patient is to take up fixation with the fovea of the deviating eye, and therefore when you remove the patch, you're aiming that the patient will eventually appreciate diplopia. Here are a list of exercises that aim to remove the suppression scotoma within the periphery or at the CIP. In this instance, what we're doing is we're trying to stimulate the periphery, so the area of the CIP, in order for the patient to begin recognising diplopia. Okay, when we prescribe orthoptic exercises, how regularly should the patient perform these exercises? Well, firstly, you would have noticed there are exercises there that require your patient to come into clinic, such as if you're using the synoptophore, you would require your patient to come into the consulting room. Because of the limited availability of clinical appointments, more often orthoptists will prescribe exercises that patients can take home, so red filter drawing or occlusion, etc. Where you have an exercise that requires the patient to do an activity, such as with a gyroscope or red filter drawing, etc., it's best to do them 2-3 times a day and for about 5 or 10 minutes. If you're prescribing occlusion, then part-time is usually sufficient, although you could do full-time if you wish. And then again, if you prescribe prisms, generally these will be Fresnels because they're a temporary prescription, and these can again be worn full-time or part-time. In terms of the length of treatment and when to review the patient, often it can take a few weeks for your patient to start to anti-suppress. And as such, you want to see these patients regularly. Some patients will clearly take longer, than others to anti-suppress. And it's worth noting that some patients will be almost impossible to anti-suppress, in which case if you can't anti-suppress the patient, you can't then progress to any of the convergence or divergence exercises. Okay, that brings us to the conclusion of this video. Thank you for watching.